As part of the Paths to Prevention series with Allianz, I'm meeting with Dr. Ulli Sucher to talk about diabetes. So, Dr. Ulli, what exactly is diabetes?
Well, diabetes happens when your body can't deal with sugar effectively. You eat sugar, it gets into the bloodstream, and what happens then is that triggers insulin secretion.
Okay.
That is produced by your pancreas. So if there is either too little insulin or the cells have decided that they are not accepting the insulin, which means insulin resistance, then we have a problem because you have the high blood sugar, but the cells are starving.
A lot of people associate this kind of conversation with really high sugary foods, but it's not as simple as that, is it?
It's any kind of processed foods, unhealthy foods as we know it, savory food.
Oh, really?
Which we really think is not the case,
Yeah, I was thinking
right?
sugary cereals or fizzy drinks, but it's more than that, savory foods too.
It's more than that, exactly.
And then what happens to our bodies then when we have this resistance to insulin or there's too much blood sugar?
When that happens is that it damages the organs.
Okay.
The main organs, actually every organ, but mainly the kidneys, the small vessels in the eyes.
The eyes, okay.
Yeah, the nerves, that's when you get this tingling in your feet.
I know there's a term visceral fats. What does that mean?
It has been found that there is a very, very direct correlation between the fat that you carry around your middle, the waist, and that's called visceral fat.
Okay.
So when that fat is there, then you have to go to your doctor and really get into a program to reduce that.
And what are some of the signs then, maybe some of the early signs we can look for?
Constant thirst.
Okay.
Thirst and going to the toilet. So if that happens, that has to be kind of a red flag. Fatigue or unusual weight loss that you can't explain.
What do we need to do with our food intake?
In the case of diabetes, obviously, this is extremely important.
Right.
Avoid sweets, avoid cakes, baked foods. That is a given, I'm afraid.
But you don't always like to talk about things we need to avoid. You also like to talk about things we can add in.
Exactly. And I'm coming to that. Eat a rainbow. All the fruits and vegetables. And in the case of vegetables and fruit, also the fiber is extremely useful to prevent diabetes because it slows down the absorption of sugar. Healthy fish, oily fish. If you add all that, you will automatically reduce the not so healthy.
Of course, yeah, that makes sense. Yeah, almost every disease we've spoken about, physical activity is so important.
It's proven that 150 minutes of moderate physical activity goes a long way.
So screening then becomes really important, right?
Exactly. Either you go separately or it's incorporated into your yearly screening that you do. And as I always said, mark a month in your calendar when you're going to do it. Because that way you don't forget and it's done.
You're not too
and
busy,
dusted.
you have it in your calendar, yeah. So any final thoughts then for everybody listening and watching on diabetes?
Yeah, it's not that difficult. And especially watch your kids, what you feed them, how you keep them active, because you set them up for a good and healthy life.